Hi, I'm Brian Shaw, Certified Diabetes Educator with Sacramento Native American Health Center. Welcome to the 5th episode of Take 5, Ask 5, where we take 5 minutes to ask each of 5 experts the top 5 things to know about what they know. We are here today with Dr. Hakeem Adeniyi. He is SNAC's Medical Director, and he's a primary care provider here at SNAC. Thank you for being here today, Doctor.
Thank you for having me, Brian.
Yeah. So, Dr. Hakeem, we would like to know, diabetes is a very, manageable disease. COVID-19 has ravaged communities and has been around for now almost 3 years, going on the 3rd year here. What do we need to know about COVID-19 and diabetes?
It's a great question. So there are a couple things that we can talk about. But first, I want to say COVID-19 can cause your sugars to go up really high if you have diabetes and if you don't have diabetes. So there was recently a report that came out through the CDC that children, so people under the age of 18, after getting COVID-19 are 2.5 times more likely of getting a diagnosis of diabetes than they were before. And we're also seeing it with adults too, because part of what we see is that the body's stress response causes us to release sugars and our sugar goes higher. Number two, people with diabetes are at higher risk of having severe illness and complications resulting from COVID-19. So much more likely to end up having to stay in the hospital, have to stay in the hospital longer, and potentially needing a higher level of care. So some of the things that we see with that is that people with diabetes tend to have more inflammation inside the body and are at higher risk of developing blood clots, heart attacks, and strokes. So that's part of the reason why we really need to pay attention to it. Third, it's important to be familiar with the signs and symptoms that we see with COVID-19. Oftentimes we talk about fever, chills, cough, shortness of breath, nausea, vomiting, and the loss of taste and smell. So that's really important. But it's also extremely important to seek out emergency care if you develop trouble breathing, persistent chest pain, new confusion, if your sugars go up dramatically in a short period of time, or if you're starting to see some bluing of the lips, the tongue, and the hands or feet. Fourth, the best way to reduce the risks associated with COVID-19 are to get vaccinated. So get your primary series. We often talk about getting one of the messenger RNA vaccines, whether that be Pfizer or Moderna, and then getting the booster when you're eligible. So usually 5 months after you got your primary series is really important because it helps reduce your risk of death, helps you reduce your risk of being hospitalized and of having serious complications. And then lastly, if you do happen to get COVID-19, it's important to listen to your body and take proper precautions. So drinking lots of fluids, making sure that you're monitoring your sugar closely, making sure that if your sugars become really low, that you take the proper precautions to get those sugars up. And on the other side, if they become really high, to make sure that you reach out to your primary care provider or physician and to seek out medical care to make sure that we don't have any other complications. I hope that this was helpful.
Yeah, amazing. So, okay, top 5 things to know about COVID-19 and diabetes. Number 1, it can cause your blood sugar to go high in general, even if you don't have diabetes. This is the body's response to having an infection. It's a protective mechanism. If you have diabetes, it can cause your blood sugar to go up even higher, and that's a risk. We want to avoid that if we can.
Exactly.
Number 2, people with diabetes have a higher risk of getting severe illness from COVID-19, right? So we know that people with diabetes and other complications have a higher risk of ending up in the hospital, needing more severe interventions for COVID-19. Number 3, it's really important to know what the symptoms are of diabetes and take care when you have those symptoms, recognize them, and get the right care for that.
Exactly.
Number 4 is make sure that you get vaccinated. Vaccines don't always prevent the disease, but when they do, it's less likely that you have the severe symptoms.
Exactly.
Get both of the messenger RNA, get 2 doses of the messenger RNA vaccines and get the booster to give you that further protection to last for longer. Exactly. And the last one is if you do get COVID-19, listen to your body. Again, make sure you get the proper medical care. Make sure you have good self-care if you are diagnosed with it.
Perfect.
Excellent. Well, so this has been great. Thank you, Dr. Hakeem, for coming to see us today. Thanks for your expertise. Tune in for our next series of videos where we talk about other topics related to diabetes, and we'll see you next time. Bye-bye.